I've lived with sickle cell my whole life. I've never known anything else. I have sickle cell disease. I have SS. That's the most severe form of sickle cell disease. The doctors told my parents that I probably wouldn't live to see my 18th birthday. Sickle cell was like a death sentence. But now it's totally the opposite. I mean, people can live effective, prosperous lives, healthy lives with sickle cell disease. So I think that we've come a long way. Since I was a child, my parents have always told me, you can be whatever you want to be. You can do whatever you want to do. But after I had my daughter, I was really, really sick. I had a lot of hospital admissions, more than normal, more than I've ever had, and I would get really, really sick.
Good job on your picture. High five.
A crisis is the hallmark of sickle cell disease, and a crisis is just pain in any location of your body. You can have it wherever blood flows. If I had to describe it, it would be like repeatedly being stabbed with a butcher knife in the same spot nonstop. That's what it feels like. So growing up, from the time I was born up until maybe I was 8 or 9, I took penicillin every day of my life. And the purpose of that, I think, is to prevent any kind of infection, just in case. My brother, who's had many more complications than I had with sickle cell, he tried hydroxyurea when he was about 13 or 14, and every side effect that the medicine could offer, he had. So I was afraid to take it, but I thought it wouldn't hurt to try it. So I started taking hydroxyurea in May 2009, and it has really changed my life. I haven't had an admission in 13 months, and it's my numbers, my blood numbers are wonderful. My doctor is totally pleased with it. I haven't had any negative side effect from the medicine. It's really wonderful. It's been good to me. It's so much more important for me to stay healthy now is because of my baby girl. The day she was born, they tested her for the disease, but I knew that she didn't have the disease because her dad doesn't have the trait or the disease, but she does have the trait. It's really important for me to stay healthy for her, but also it's important because I love what I do. I love my job. I love life, and it's not fun being sick, so I do everything in my power to stay healthy. Take my medicines every day without fail. I don't smoke. Never tried to smoke. Never will smoke. But I do eat fairly healthy. I think the main thing I do is my fluid intake. That has a lot to do with how well people do with sickle cell disease. Life right now is great. I'm healthy. I'm a mom to a beautiful little girl who I love so much. I just bought a house, so I'm really excited about that. And I'm in school, getting my master's in healthcare administration. It feels great to know that, yes, when my parents told me I can do whatever I wanted to do and be whoever I wanted to be, that I'm actually doing it now. Having a good attitude affects any area of your life, whether it's health-related or job-related or any area of your life. So I always try my best to have a good outlook on life. I have sickle cell, but sickle cell doesn't have me.